Hello, everybody, and thank you for this opportunity. It's my pleasure to present here this paper, Impossible Explanations Beyond Explainable AI in the General Data Protection Regulation from a COVID-19 use case scenario. This research project is a fully cross-disciplinary project that was conducted in the last year, in the last month, and is still producing fruits by lawyers and computer scientists. I introduce myself. I am a lawyer. I am Malgieri, Associate Professor of Law and Technology at the Augmented Law Institute at EDEC Business School in France, in Lille, but also affiliated researcher to the Law, Science, Technology and Society Research Center of the Free University of Brussels. I was not alone in this project, but I had several great partners, in particular Dr. Ronan Hamon from the European Commission, Joint Research Center, and Dr. Henrik Junklewitz from the same institutions, and they are both computer scientists. Then a partner of legal analysis was Professor Paul Hert from Freie Universiteit Brussels and Tilburg University. And then other two computer scientists from the Joint Research Center of the European Commission, as Dr. Laurent Beslay and Ignacio Sanchez. So we started from observing dualisms, trade-offs, and contradictions of explainable AI. So we started from some dualism and contradiction, in particular explainability versus interpretability, and again, explainability versus justifiability, interpretable models versus post hoc approaches, and interpretability versus accuracy. Because we know that, first of all, explainability is more subject-centered, is oriented to the human subject, while interpretability is more looking at the model itself. Again, explainability and justifiability are different, because explainability is just the capability to express to humans why a certain decision was taken, so which are the causes, the steps, the relevant factors, while justifiability is something more, is something different, more comprehensive maybe, is the capability to express to humans why a certain decision is compliant with certain rules, so why it is just, it is legal, it is fair, it is accurate, it is non-discriminatory, etc. And often, all the explainable AI literature and scholars forget that what might be more interesting for subjects and for the general audience is more justifiability than explainability. Of course, justifiability needs explainability, as we will see in the last slides. And again, we can have interpretable models by design, fully or partially designed to provide reliable and easy to understand explanations of some predictions, or some post hoc techniques to extrapolate explanation from an existing black box model. Also, there is a problematic trade-off between accuracy and interpretability, because usually more complex models that have higher performances and are more effective are even more opaque, obscure, less understandable. So usually, if we want, and this is something that we have been hearing for years, for ages, if we want more understandable systems, maybe we are going to lose in performance. We will see how all this can be maybe overcome. Of course, also the law poses several problems. The GDPR, the European Union General Data Protection Regulation, so the regulation of privacy of personal data, has several different problems that should be taken into account. In particular, the definition of profiling, which is an analysis of personal characteristics to assess subjects or to take decisions on them, must respect the principles, the general principle of data processing: fairness, lawfulness, transparency, data minimization, accuracy, purpose limitation, integrity, accountability. But also, automated decision-making that produces legal or similarly significant effects are prohibited unless an exception applies. And exceptions are explicit consent of the subject, member state law, contractual necessity. And then suitable safeguards should be implemented in this case, including the right to contest, the right to express one's own view, and the right to have human intervention. And in addition, in case of higher risk, also a right to have individual explanation of the decision taken and also an audit of the algorithm. Well, in case where automated decision making is permitted, the data subject, so the individual, the user, the consumer, the patient, has also the right to receive meaningful information about the logic, the significance, and the budget consequences of the algorithm. As you can see, this is very problematic because the subject needs to understand the logic of the system, needs to be able to contest the system, so needs to understand how the system works, need to give consent, and to give consent you need to understand at least a little from the beginning how it works. All this led us to develop a system of dynamic explanations and layered one, considering three factors: the time of explanation, the audience of the explanation, and the granularity of explanation. For what concerns time, explanation can be ex ante or ex post, and we will see in next slides what we mean. The audience can be also expert-oriented or user-oriented. So based on the expert of the sector or based on the final individual, the final consumer, the final patient, the final user. Also, the level of granularity can be very different. We can have very general explanation, we can be intermediate, group-based explanation, or we can have individual explanations. Well, looking more in particular to the time of explanation can be ex ante. So it's an explanation given before the decision making starts. And meaningful information about the logic should be given, as we were saying. The user might be interested to decide whether to consent or not, and so to understand. Also, ex post explanation is a bit different. Ex post explanation is to enable to contest the decision or to finding elements to identify wrongdoing of the system, or on the contrary, confirming the decision. Well, for what concerns the audience of the explanation, this is also very problematic and particular. The audience of the explanation can be data subjects based. So, for example, it can be to patients, so addressed to patients. And if it's a data subject, of course, it's a user with less technical knowledge, less domain knowledge, and they need to receive information to give consent or to contest a decision. On the other hand, we have the expert that can be, for example, medical staff, as in our example, and they have higher knowledge, higher expertise, but they have to check the validity and the accuracy of the system. Of course, we have two different priorities and needs, because while the data subjects prefer simplicity and sobriety to efficacy or fidelity of explanation, expert needs more efficacy and fidelity instead of simplicity and sobriety. And so also the granularity of explanation is very different. We can have a general explanation that is usually given at the beginning, at the outset, but can be given anyway. It's referred again to meaningful information about the logic. But then if we look at the GDPR, we have general explanation, we have individual explanation, but we have also an intermediate one. Because if I have to enable the right to contestation, I have to give some information about how and why similar people were treated. People similar to your group, people similar to that subject. And then, of course, individual decision about why a certain decision was taken in an individual case. And this depends on the level of risk. The higher is the risk, the more granular should be the explanation. So in very high level of risk, we should also give individual explanation. In intermediate level of risk, a group-based explanation is enough. In very low risk, just meaningful information about the ex-ante generalities of the algorithm is okay. Well, now it's time to look at our case study. Our case study was suggested by COVID-19, of course, but not just because everyone is talking about COVID-19 in research in this month, of course, but because it was a clear, important application of AI that was very relevant for our purposes. So we take the example of a patient with serious symptoms that accesses an emergency ward of an hospital during an ongoing outbreak. And normally such patients would be admitted after decision of a medical doctor to the intermediate care. But in this case, all doctors are unavailable for at least several hours. Pneumonia can, we all observed how COVID-19 can be aggressive and rapid. So we need to decide immediately. So the subject, the patient, can decide to let an automated decision system to decide how there might be a chest X-ray image of the lungs, and then the algorithm compares through deep learning how this lung image can be similar based on image analysis, so medical imaging can be similar to COVID-19 affected people. And this is not just a dream, this is reality, as many papers in literature already address. So if we look at the technological relevance of the case, well, the case is very complex because it's based, if we try to analyze and to understand this case, this algorithm is based on 5 million different patterns extracted by the training procedures of 3 by 3 pixels. And the prediction score is weighted a combination of the contribution of each of these patterns for the considered image. But only a fraction of them is directly extracted from the image and used by deep neural networks. The performances don't reveal so much in terms of explanation, but reveals that the system is working and are high-level performances. And then there is this typical approach, which is occlusion, called occlusion maps, that consists in masking a portion of the image and tracking the evolution of the score. And the resulting maps indicates the region where the characteristic of the infection people are, or the infection regions are, and the non-infection. Of course, we have no guarantee that these regions are really revealing the infection or not, and are significant or not. So it's extremely hard. And of course, this brings to legal problems because, this case is highly legally relevant, has a lot of implication in terms of GDPR. Why? First of all, because it's an automated decision making and it's conditional to the existence of a law or to patient's consent. Well, the consent need to understand how it works. The risks are high. It's a case of high risk. Why? Because if you receive a false positive, you first of all can have highly damage in terms of psychological damages because you are diagnosed something that you are not. You have higher risk of getting, in fact, going to the hospital again, so continuing to the hospital, and probably in a period where there are no many medical products and healthcare and times of doctor activity, etc. Maybe a false positive can create even a bigger distortion of allocation of medical products to people that really need it. On the other hand, a false negative is risking to produce even a more outbreak of COVID-19, infections of a familiar, etc. And of course, it can lead to the death of the person. Well, we already said that in case of high risk, we should have a right to explanation of artificial intelligence, audits of it, and also a data protection impact assessment should be done. These are all problems that should be taken into account. So, if we try to implement our multi-layered and dynamic explanation to this case, let's try to give some examples. So, for example, if we want to give the ex-ante general information to the patient, so ex-ante is the time, general is the granularity level, and the patient is the audience. You remember we did the 3 different considerations for explanation. In this case, we are explaining that this is an automatic decision-making system that has been developed to assess the probability. We say how many images trained the algorithm, what is the percentage of negative and false negatives, what are the principles in this AI, very simple word, very sober, what are the data. We give an example of how a lung analysis can be, the average outcome, and very short statements about the performances. And then, after the decision is taken, the patient needs to receive an explanation of the decision if he wants or she wants. And so, for example, you received a score of infections of 71%, indicating you are negative to COVID-19. The performance is a 69% reliability, and group-based explanation. So for people similar to your case, the precision is 65%, for negative patient, 54%. But what about the expert-oriented explanation? So the explanation that the doctors need to receive in order to understand if a contestation can be accepted. Or again, as for example, in the UK system, you have a right to understand what the data controllers did, the human did, to comply with your contestation. So in this case, the doctor can receive a more granular explanation, more specific one. The decision-making system is based on deep neural network. We name the architecture, we name the pneumonia symptoms and the pneumonia characteristics. We also can give some performance analysis. And to the specific case, we can also produce with this system that we try to design in this paper also a counterfactual. So comparing the lung of a COVID-19 person to the case and looking at what are the regions of the lungs, the regions of X-ray that can reveal COVID infection. But what if satisfactory explanation are not possible? Because is it really a satisfactory explanation? Just comparing two lungs, is it enough to explain why a decision was taken? We just said there is an algorithm and it does this. We didn't explain the logic, the significance, the cause and the effect. There is a lack of causality in this deep learning. Medical imaging is mostly based on correlations, not on causation. Human mind cannot really understand. So, to conclude this presentation, we propose two different paths. The first one is algorithmic impact assessment. It's already proposed by the Data Protection Impact Assessment in the General Data Protection Regulation, the GDPR. You need to describe the processing, so understand it and a bit explain the algorithm. It's also a way to explain the algorithm doing the Data Protection Impact Assessment. But the most important part is that you need to assess the risks. And while you explain the risk and you mitigate the risk, you are also giving an algorithmic justification. So you don't look at the black box inside, you look at the effects of the black box. It's a way to circumvent the black box and go beyond pure explanation. This is a dynamic form of explanation. And so it also brings to redesigning the processing according to the feedback. And so restarting the process, which is a continuous multi-stakeholder processing. And the second possibility is justification of algorithmic decisions. The data controller shouldn't just explain the algorithm, should justify. So looking at the impact, we should explain, and also the training data, we might look at higher level of deep learning and not losing its performance, its effectiveness, but also looking at accountability principle. The data controller need to look at the ex-ante data, so the training data and the final impact, and explain how it complies with lawfulness, fairness, transparency, purpose limitation, accuracy, storage limitation. And you know what? These are all principles that are already in the GDPR. It's already there. But if we apply them to artificial intelligence, they're extremely powerful. Fairness is already there. Purpose limitation is already there. Data minimization is already there. Accuracy, integrity, accountability. So we think that the story still needs to be written. But we have the right tools to do that. So thank you very much. And we are very, very happy to hear any feedback, comments, and questions about it. Thank you.